Ever felt like your mind is on a high-speed train, racing through a landscape of thoughts, ideas, and distractions, with no breaks in sight? For millions, this isn't just a momentary sensation, it's a daily reality. Welcome back to our series where we dive into the intricate world of ADHD, a world where attention can be both a superpower and a challenge. Today, we're digging into the mystery of how ADHD is diagnosed in the US. Stay tuned till the end to know how these procedures vary on a global scale. You are in for a shock when you find out the variations in this diagnosis. Attention Deficit Hyperactivity Disorder diagnosis in the United States follows a structured yet flexible approach. There is no single definitive test for ADHD, but rather a comprehensive evaluation process that involves several steps and considerations. The process typically begins with a consultation with a healthcare provider, such as a pediatrician, psychologist, or psychiatrist. This initial step is crucial for identifying potential ADHD symptoms and determining if further evaluation is necessary. Healthcare providers use the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, as the primary guideline for ADHD diagnosis. The DSM-5 outlines specific criteria that must be met for being diagnosed with ADHD. For children up to the age of 16, at least 6 symptoms, and for adolescents and adults, at least 5 symptoms must be present for the last 6 months. These symptoms must interfere with their daily functioning or development. Symptoms must be inappropriate for the individual's developmental level and must be present in multiple settings, for example, home, school, work. The evaluation process typically includes detailed medical history, physical examination, family history assessment, behavioral observations, interviews with parents, teachers, or spouses, completion of standardized behavior rating scales. It's crucial to rule out other conditions that may seem similar to ADHD symptoms. These can include sleep disorders, anxiety, depression, learning disabilities, thyroid problems, and seizure disorders. For children, the American Academy of Pediatrics recommends that healthcare providers collect information from parents, teachers, and other caregivers about the child's behavior in different settings. ADHD often coexists with other conditions. Clinicians must consider and assess for potential co-occurring disorders such as anxiety, depression, or learning disabilities. Based on the comprehensive evaluation, if the individual meets the DSM-5 criteria for ADHD, a diagnosis can be made. Based on all the reports and observations of the symptoms, the clinician will specify the type of ADHD in the diagnosis. The most important question here is this diagnostic procedure universal? Here is the kicker. ADHD affects millions worldwide, but did you know that its diagnosis and treatment can vary dramatically depending on where you are? Shocked? Let's find out. In the UK, children wait an average of 18 months for an ADHD diagnosis. The diagnostic procedures take almost 2 years before a child is termed to have ADHD. In France, the CFT-MEA protocol is used for diagnosis, and unlike the US, the procedure is longer and considers a broader perspective, including the child's social circumstances and family interactions. The entire process might take 2 or sometimes more than 2 years for a child to be diagnosed with ADHD. In Japan, ADHD is often viewed through a different cultural lens. There's been historical resistance to diagnosing ADHD, with symptoms sometimes attributed to character or parenting issues. In many African countries, ADHD awareness and diagnostic resources are limited. This creates a significant gap in the identification and treatment. As compared to the US, which reports 8.1% diagnosed with ADHD, countries like Iraq reported 0.1%, Poland reported 0.3%, and Romania reported 0.4%. This global variation raises questions. Are we overdiagnosing in some places and underdiagnosing in others? Is ADHD truly more prevalent in certain cultures, or is it just recognized more? As we move forward, there's a push for more standardized, objective diagnostic tools. Computer-based tests are gaining traction, offering instant results compared to normative data. Stay tuned for our next videos in this series, where we will explore the causes, the treatments available, and debunk the myths, because when it comes to ADHD, there's always more to explore, more to understand, and more to appreciate. Thank you for joining us on this journey. If you found this video helpful, please share it with your family and friends. Don't forget to like, share, and subscribe to the channel for more such content.